Jolene Kron, I'm the deputy.
Sorry. We didn't want to
Jolene,
miss that Jolene said.
just my last name or just the title. I'm Jolene Kron. I'm the Deputy Administrator and Clinical Director with the Salish Behavioral Health Administrative Services Organization. We are responsible for the crisis continuum and non-Medicaid funding across the 3-county region, Kitsap, Jefferson, and Kron.
Dan, tell me the correct way to say your last name.
Zemensky.
Semensky.
Yeah.
Can you tell us a little bit about what you do?
Sure. Yeah. So I'm the new executive director of the medical group here at Jefferson Healthcare. I've been here, since April 19th, so going on a couple of months. Before that, I was with CHI Franciscan and ran the ambulatory operations in Kitsap County.
Great. Well, thank you. It's really good to have you here.
Thank you.
Matt Reddy.
Hi, so I'm Matt Reddy. I'm one of the Jefferson Healthcare Hospital commissioners, and I've been a commissioner about 7 years now. And before that, I worked at the hospital. So the commissioner, if you don't know, is basically our role is just to work with the CEO in overseeing Jefferson Healthcare operations. And yeah, that's all.
Thank you, Matt. Richard Davies.
Hi there. So my name is Richard Davies. I run the Public Defender's Office here in town for Jefferson County Courts.
Thank you. Chief McKern.
Jim McKern, Cool Scene Fire down on the south end.
Thank you. Good to have you here. Commissioner Brotherton.
Greg Brotherton, County Commissioner. Apparently my job is to keep next door flaming.
Well, I trust you're doing very well at that.
I'm accomplishing that goal.
Thank you. Vicki Kirkpatrick.
Hi, I'm Vicki Kirkpatrick, and I'm Director of Jefferson County Health Department.
Good to have you here. Lisa Thomas.
Hi, everybody. Lisa Ray Thomas with the University of Washington Addictions, Drug, and Alcohol Institute, and I support statewide opioid response work with a focus on networking and partnerships and collaboration. And then I do all kinds of other stuff too. Great to see you.
Good to have you at the table here. Gabby Cordell.
I'm Gabby Caudell. I'm the clinical supervisor of Believe in Recovery and the clinical supervisor of the RSAP program down at the jail.
Thank you. Good to have you here. Dave Fortino.
Hello, Dave Fortino, Chief Corrections Deputy with the Sheriff's Office.
Thank you. Good to have you here. Patrick Johnson.
Good afternoon. I'm Patrick Johnson. I'm with National Alliance on Mental Illness, the Jefferson County affiliate.
Thank you. Sheriff Knoll.
Hello, Joe Knoll, Jefferson County Sheriff, and part of my duties are to provide work for Richard Davies.
And Sheriff Knoll is also doing a good job. Jim Novelli.
Jim Novelli here, Executive Director, Discovery Behavioral Healthcare.
And thank you. Brian Richardson.
Hello, Brian Richardson. I work for Dove House as the Recovery Cafe program. And we are open for meal service Thursdays noon to 3, Fridays 10 to noon. We'd love to see any of you guys down here.
Great. I keep hearing from people who are over there. One of them is Mel Melmid. She was just there today. She was saying how happy she was to be involved in that. Chief Black.
Britt Black, East Jefferson Fire District Chief, new guy at large, and glad to be in a state where I can see measurable rain. I came from California.
We're glad to have you here. How about Adam York?
Hello, can you hear me okay?
We can.
Home. Yeah, I'm Adam York. I'm a data analyst at Jefferson Healthcare. And I missed if there was a question or anything I should be answering, but Just happy to be here working on data all day, every day.
Which we could not do without. Thank you for being here, Adam. How about Denise Baker?
Hi, I'm Denise Banker. I work for Jefferson County Public Health. I'm the Community Prevention and Wellness Initiative Coordinator, and I do drug and alcohol prevention work in the community. Thanks.
Denise, I think you're waiting to hear on maybe some funding for some prevention coalition. Does that happen today? I heard from somewhere else it might come out today.
Yes, we're waiting for it today, and Vicki Kirkpatrick and I should hear whether or not we got it.
Okay, great. And John Nowak.
I was just keeping my fingers crossed for you guys,
Oh,
actually. I'm John Nowak. I'm, along with Lori, co-executive director for CHIP in Jefferson County, and also work at the hospital.
So for those of you who came in late, our newest addition is Dan Zemensky, and he's here from Jefferson Healthcare. And I'm sure we'll get to know him more later, but I just wanted you guys to know we got somebody new at the table. Let me share my screen quickly and just give you an overview of what we plan on talking about today. First, we have Richard Davies, who's going to give us an overview. Can you guys see the screen, the slide? Okay, great, thank you. An overview of the programmatic review that was done of the Therapeutic Drug Court. And then Jolene Kron is going to give us an update around what's been happening in the 2021 legislative session around funding and measures that are have been talked about there. And then with what time we have left, we'll talk a bit about perhaps how we can collaborate to optimize some of these funding resources that we see are coming down the pike. I wanted to quickly give Lisa Ray Thomas a chance to tell us about an upcoming event she has.
Thank you so much, Lori. So this is our second annual Transforming Our Community, supporting people who use drugs, and sadly, and with gratitude, it's virtual. So the afternoon of June 29th and the morning of June 30th, the first day we'll all be together talking about themes that are overarching across all of them. The second day we'll have 4 different tracks in the morning, and then we'll come back together. And I can put a link for the website and how to register in the chat. Thank you, Lori, and thank you, everyone.
Thank you. Okay, so I'm going to turn over the next piece of the program to Richard Davies. And I want to just thank him for working with me. I know he's got a lot going on in his office right now, but I thought it was really important that he come and sort of give particularly everybody at this table a sense of what's going on over there with the Therapeutic Drug Court. Go ahead,
Right,
Richard.
well, I'll take it away if you can all hear me. So my name is Richard Davies. I work here at the Public Defender's Office, and I've been on the drug court since its inception back in 2003. Currently, it's Superior Court Judge Harper is the judge. James Kennedy is the elected prosecutor and drug court staff member. Ms. Caudill from Believe in Recovery is a member of the drug court team. Ford Kessler from Safe Harbor is also, well, a treatment provider as well as the drug court coordinator. And we have law enforcement involved also. We've had both officers from the Sheriff's Department as well as the city, although I think presently we've got Brett Anglin, a sergeant from the Sheriff's Department, who I believe is acting at the direction and insistence of our Sheriff Knoll, who participated in this program. That is to have a look at what we're doing in drug court and how we're doing it. 2003, that's, a long time ago. A whole lot has happened in therapeutic courts since. And so what I wanted to do, kind of desperately actually, called a couple of you folks, how to get best practices used in our drug court. And, I'm thankful to those who I reached out to, gave me a little bit of direction. I ended up contacting the National Drug Court Institute, imagining it was going to cost a pile of dough to have somebody come in and do an analysis, and lo and behold, turned out to be free. So that got us moving on the project. So we met as a team, filled out, one of those bubble test questionnaires with respect to best practices and or not. And then fairly recently had the NCDCI, sit in on drug court staffing, and it's all virtual at this point, but drug court also, based on the responses that we gave them, as well as their questions to us as individual team members and watching the proceedings, they came up with a report. And so what Lori did is basically put into a presentation form their findings. So kudos and thanks to Lori for doing that, because otherwise you'd just have me on mute and you wouldn't be able to see or read what the conclusions are. So next slide, if you would, Lori. All right, and so the report is broken up into a couple of different sections: summary of best practices, what we're doing, what we're not, priority recommendations, additional observations, specific recommendations, and next steps, as well as a best practice table. And so next slide. All right, so priority recommendations, and from my point of view, they are listed in most important first, and that is their recommendation was to implement the use of standardized assessment tools to determine eligibility. Exclusion criteria should be defined objectively, specified in writing, and communicated to potential referral sources. And this is something that we've struggled with in our drug court, well, for a long time. How do you decide who's getting in? And at present, it's the prosecutor that gets to decide whether an individual who's been charged with a crime is going to get into the drug court program. And from my perspective, that's a very subjective analysis that the prosecutor does, in consultation with other team members, as other team members often, have their 2 cents to put in. Law enforcement, quite frankly, is really helpful in that regard, but it's very subjective. And while that, works for a little community like here, I think it also excludes people who would otherwise qualify if we had standardized tools that are more objective than, well, geez, I dealt with this fellow 10 years ago. I dealt with his dad 20 years ago, and it was his grandpa, when I started. And, that may sound preposterous, but I've got clients who are the grandchildren of the first set of clients I dealt with when I got here. So it's not, but, and so I might say, oh, gee whiz, that family, I'm not sure they'll ever really want to come around. That's not a way to decide whether people are getting into a drug court or not. So that's something that we have to do as a court. And what I'm hoping this group can do is support drug court's effort in coming up with funding. And actually, I don't think that's a pile of money either, but we need that standardized assessment for people getting in. 2, provide drug court model training for drug court team members. I've been to one training. It was a national conference in St. Louis. I'd say it was 10 years ago, which probably means more like 15 or 20. And having never been to the Midwest, I skipped a couple of classes and drove up the Mississippi. So it wasn't, well, it was useful, but maybe not for the intended purpose. We need to do this every year and take it as seriously as we do with respect to training for, the other half of the business of criminal justice. So that's number two. Number three, incentivize participants through increased focus and use of rewards. It's really hard for courts, prosecutors, maybe not so hard for defense attorneys, to get out of this, well, you better do it or else you're going to jail. Or if you did something bad, you're going to jail. It comes up, every staffing, and getting out of that model is really hard for, people that have been doing this in their sleep for, well, as many years as I've been or more. Number four, ensure drug testing is random, unpredictable. Trouble with the program right now is that, there's basically a couple free days every week, and it's on the weekend because we don't have an ability to do those tests on the weekends or holidays. And, when you're trying to work an honest program, it's easier to do if you only have to do it 5 days a week. So that's something that they pointed out as a recommendation for us. Add law enforcement. We do have law enforcement. When we first got law enforcement involved, I was waving my arms around, kicking and screaming, suggesting that was a terrible idea. It's not. And it's actually really useful to have law enforcement on the team. What we need is somebody dedicated to it, as opposed to, running off to put together warrants or, make arrests. Because it's important that they're there for all the drug court sessions and team meetings. And then we need to revise our old policies and procedures that date back to 2003. The trouble is we're so busy, it's hard to do that. All right, so those are the recommendations, and again, pressure that this group can bring to bear on drug court to do that. I think the effort well served. So next slide, we're on additional observations. They gave us a few pats on the back. That's how you get people to do what you want them to do, as opposed to threatening to put them in jail. So there's compassion, there's commitment, and there really is within the whole team, the prosecutor included. The other thing that they recommended is that there be a stabilization phase of treatment. Right now, you get into drug court, you're addicted to substances, and drug court's request and or order is stop using drugs. That's hard to do when they're in drug court because they've got a substance use disorder. And the national standards suggest you get people stabilized and then you move them into those requirements that require that you not use to get through the program. Consider formalizing advancement through phases. That's a recommendation. At present, probably kind of over. Not it may be needed because we have so few people, but as we build the program back up, we're going to need those formalized phase advancement. Encourage to explore allowing providers who offer multiple pathways to recovery. That I've been trying to advocate forever. I do think that it certainly exists in our community. The Recovery Cafe, I think, is testament to that. And I think Ms. Caudill's program is not strictly a 12-step, although she may pipe up and tell me otherwise. Then encourage a succession plan. And that's in part because Mr. Kessler, who is the director of Safe Harbor, is the only other drug court staff member who's been there since the beginning, and he's announced a retirement. I'm not so lucky. So that's what that's about. And encourage having the entire team, especially program coordinator, join this therapeutic listserv, so that we can keep up on the best practices that are coming into use. All right, so next slide. All right, successes and accomplishments. Commended for being open to new ideas, striving to make improvements. And so I think that's directed only to me. Actually, I'm kidding. Joe is as interested in, making new ideas come to being, and Superintendent Fortino, as well as Ms. Cadill. We've got a treatment program in the jail. Again, that's something I'm waving my arms around saying we can't be doing that. It turns out that it's a program that is really helping people out. My concern was we'd be, jailing people so they would get the treatment. That's not how it's working. It's working for people who are otherwise in jail, serving sentences or long pretrial detention based on past contacts with the law before trial. So we're not stuffing people in jail to do treatment. We're getting people in jail the treatment that they need. Consider an alumni program. We have at least a nascent one. That's something that I think, NDCI suggested we facilitate more. And then the last there is Believe in Recovery. Again, that's talking about the program that Ms. Cadill and Superintendent Fortino will put together there. So that's great. Next slide. Additional concerns, recommendations, MOUs between agencies. That's a great idea. It's just going to have to be somebody else writing them because, I understand what those letters stand for, but I've never written one myself. Create a written program participant manual. Again, a really good idea and one that exists, but dates back to 2003. Here's the big ticket item in my view, and that is work to decrease frequency of extended jail sanctions and use of jail as an alternative to detox or when awaiting treatment beds. That happens a lot. And again, it's about changing, the courts and the lawyers' understanding of how to get people to do what you want them to do and what they would do if they weren't so well loaded. Institute dedicated client management information system. That's something that we need to put together. Right now it's more to do with institutional knowledge, and that works to some degree because it's a small community, but we really need to put together a data so that we can make decisions going forward based on that, as opposed to what we think works, because it often doesn't. And then this idea that we get into bigger ideas and how to put together policies at work for our community, as opposed to just the client that's in front of us in court every day. So, and the next slide, specific recommendations they made. That's all pretty self-explanatory. And what we're going to be doing is, I hope, training going forward as a drug court team, and that would include the behavioral health court, and get the training that we need to do best practices. Felt a little sheepish that the number 3 recommendation is that you all go to law school 101. Maybe that's a hint that maybe what we did 30 years ago in law school, isn't in our recent memory. I'm not sure. So in any case, that's the recommendations that the national group made, given their analysis. I'm hoping going forward, it's going to help guide us in a direction that relies on best practices, and and not just our commitment to trying to help people get clean and sober. So any questions, certainly willing to answer those, whether it's now or after the rest of the program. Thank you.
Sorry, it took me a minute to find mute. Let me stop the sharing. Thank you so much, Richard, for giving us an overview of what was going on there. Is there any questions that anybody has for Richard as we think about what they're doing? Patrick?
Oh, yes, thank you. And Richard, thank you for that presentation, and everyone here for supporting that evaluation. You mentioned, Richard, there's a lot of work to be done there. The contracts, for example, and the memorandums of understanding and updating the manual and so forth. I'm wondering if there might be some dollars out there that we could go after to hire someone to do that, a consultant or somebody like that. All of you on the screen are incredibly busy, and clearly you're in a position where you can contribute to that, but not do it. So in order to advance and implement what appears to me to be an excellent set of recommendations, it seems that we need some sort of resource to make that happen.
I would second that motion.
I'm looking at Commissioner Brotherton. Surely you have some bucks around, Commissioner, that you could help out with there.
I can try. I mean, I can be an advocate, but we have an elected prosecutor and elected sheriff that have more skin in this decision-making process than I do. So I'm happy to be part of the process, but I cannot wave my hand. I mean, I can wave my hand, but can't wave my hand to make anything happen.
I'll decide that Greg has to free up money for the program.
All right. I think that'll be unanimous. But anyway, there may be some resources outside of the county that might be available and certainly worth pursuing.
I think it would be interesting to set up a bit of a description of what that would involve so that we knew what we were funding and maybe to what extent it needed funding. Maybe that's a place to start, and I don't know who to work with to do that, but it seems like that might be a good first step. John, I saw that you had your hand raised.
Yeah, Richard, I was wondering if, part of this evaluation was whether there was any opportunity to look at what other drug courts are doing. I suspect that things like the manual that you were talking about and the criteria for selection are things that other drug courts might have worked out. And I'm wondering if that could speed the process when we do get resources to make that happen.
So those resources exist out there. The trouble is, well, okay, so this whole thing starts last year when the prosecutor, well, actually the whole drug court team decides, we need to revamp our manual. The prosecutor starts writing one up, and I look at it and wave my arms around saying, let's have somebody from the outside have a look at what we're up to tell us what direction we ought to come, as opposed to, just recreating what we have based on the little bit of information, we have about what drug courts should look like. So we invite the national in, and there are resources out there. The national organization's one of them. It's just getting the time to, put together a new manual. I mean, it's more than just, rewriting what we did in 2003. I think it takes a dedicated person, probably a couple of months, shuttling back and forth between the drug court staff members, their organizations, primarily the prosecutor's office, but they're jammed too. I mean, it's hard enough just to, do the drug court staffing about, well, how are people doing, and then talking to them in drug court. And then I'm back to, I got like a 2-week trial coming up next week. I didn't even have time to put together a PowerPoint presentation for this, and if it wasn't for Lori, it probably wouldn't have made any sense to anybody. But having a dedicated person that can work on this, gather those examples from elsewhere, work with the prosecutor to make it, satisfactory to him and the drug court, it's, a full-time job for a couple of months. That's the trouble.
I saw that Jolene had her hand up.
Yeah, just wanted to mention that I think part of what spurred this also was the criminal justice treatment account and the requirement to update some of those policies in relation to new contracts and contract language, particularly related to MOUD or medication for opioid use disorder. And the criminal justice treatment account also added additional funds in the last round that were kind of clawed back historically, but they were put back in a criminal justice treatment account. And one of the focuses of that is expansion of drug court programs or continuation. And so the committee could consider the use of some of those funds. And again, want to be very clear that those treatment funds are quite limited, but some of those funds could be allocated to support some of this if needed. And those would be allocated by the CJTA Criminal Justice Treatment Account Committee in the county, which Richard is part of, as is Sheriff Knoll.
I see Jim Novelli.
Well, I think Ms. Caudill also.
Mhm.
Yeah.
Thank you, Jolene.
So,
Oh, go ahead, David. I mean, Richard.
well, so yeah, an effort needs to be made to, move forward, and it's got to do with training and making our manual and entrance criteria updated so it's based on today's standards as opposed to kind of what we made up 20 years ago.
Thank you. Jim Novelli?
So there are quite a few drug courts in the state of Washington that have been around for a while, and I was fortunate to be part of one in Okanogan County when I was over there. That was a very well-established drug court, and all the things you're talking about, we did. We had all those pieces and parts. We had a manual for the people entering drug court on what the do's and don'ts were and how they were supposed to go through drug court. I am sure we can reach out to some of these agencies. And it's actually, I believe, a Washington State Drug Court Association or something like that you should join and think about. And I'll be honest with you, most of the drug court people that we had in our, we had a case manager, we had a drug court coordinator that followed these people, did home visits, did drug testing. They made sure they were keeping up with their things, but they also went to the national trainings on a regular basis. All of this was funded through the 1/10 of 1% money. And that's what the 1/10 of 1% money was initially legislated as to help with drug courts and develop these drug courts. And I would have to say Okanogan, 95% of 1/10 of 1% went towards drug court, funding those positions, funding the sheriff's department, helping the prosecutors. So I look at and I'm just gonna be blunt here because I'll get in trouble, but the 1/10 of 1% money, I look at it here and I see a lot of money going to lots of different places, worth-worthy programs, but a very small amount going to the drug court, where really that's where that money was dedicated for originally. And I think when you talk about training, sending people to national conferences, who's going to incur that cost? I think that's what the 1/10 of 1% money can help with, and making sure this drug court is running appropriately and has the right staffing patterns. But there's a lot out there that we can probably share from other drug courts and probably get information from. So.
Thank you,
and criminal justice treatment account also, I know in both Kitsap and Clallam County supports individuals attending the National Drug Court conferences.
Thank you. Anybody else before we move forward? Okay, thank you, Patrick.
Sorry. Oh, go ahead, Ben.
I just wanted to point out, there's a lot of really good stuff that has happened with all of you and a lot of really good people who have worked hard over many, many years to make drug court work. And I think the context in which we ought to go forward is building on all of the things that have happened. There are a lot of things that have changed, a lot of best practices, as Richard have talked about, that can be implemented. But it's important to keep in mind that a lot of good stuff has really happened, and a number of people have really been helped as a result of drug court.
Absolutely. Sheriff Knoll?
I just wanted to thank you, Richard, for doing that. I can't think of the right words to say, but it'd be easy for you just to go with the flow. And you always seem to be, I've noticed in my, especially in the last year, that you seem to be a real advocate for drug court. And I just want to thank you for that. I know you don't, you have a lot on your plate, and it would be a lot easier just to take what comes, but thanks.
Thank you, Sheriff Knoll. And we do know that the drug court is a big part of how we are helping people access behavioral health services. And that is the point of everybody sitting at this table together, is to improve that access. So I'm sure this isn't the last we'll hear on this topic. Richard, thank you so much for your time bringing it here to us and giving us a sense of where we're at right now. And I think that there is good energy around this table to figure out how we can support the drug court moving forward. Okay, for our next bit of the program, Jolene Kron is going to give us an overview of what has been happening in the 2021 legislative session and funding updates and that sort of thing. And I'm going to share the presentation screen with her. Just let me figure out how to do that. Can you take it, Jolene? Great.
Jolene, I think you're muted.
Always muted when I don't need to be. Okay. So can you guys see my screen? Okay. Just give me 1 second. I need to move the faces out of the way. Okay. So Lori asked me to speak to behavioral health investments related to the legislature. My primary focus is things that will impact the BHASO as a region. I did include a few other things, ombuds changes and housing at request as well. So my lens definitely comes from the BHASO perspective and the rollout of new programs that are coming. So just to kind of give a general overview of kind of what happened in this legislative budget session, there were 74 total investments by the legislature in behavioral health. I have a 10-page document sharing what those are. Some of them, I think 3 pages of those relate to the Blake decision, which I'll touch on briefly as well. This is the largest number. I believe 2 years ago, there were somewhere in the arena of 36 behavioral health investments. And at that time, everybody was like, oh, that's so many, very overwhelmed in the rollout. And now we are looking at twice that this time around. So we do have investments that we are continuing to learn. We have heard, particularly the Healthcare Authority does a lot of the rollout of these programs, and they are in the process of hiring additional staff to be able to program manage some of these. So we expect some of the rollout may be a little slower than I think anybody would like, but just wanted to add that caveat as we kind of go through. So legislative funding update related to Senate Bill 5476, the Blake bill. Is everyone here familiar? I know we've kind of talked about it before. Kind of brief overview. It was a Supreme Court decision in February related to charges for simple possession. It impacted drug court significantly, criminal justice treatment account as well, changes to law enforcement. And with those decisions, there were then funding allocations that have been identified, particularly on the treatment side, for individuals with substance use disorder. And then it also spun off on a law enforcement bill that I'll also speak to briefly. So there is a one-time allocation. Oh, sorry, I'm on the wrong side. Senate Bill 5476 requires the development of an SUD recovery navigator program. We are awaiting information related to that program. So that one piece of the funding is to hire within the BHASO. So we will be posting a position for a substance use disorder coordinator for all 3 counties. So that is occurred in ASOs all across the state. And that individual will be tasked with rolling out some of these programs. One of those is the SUD Recovery Navigator Program, who is the individual intended to take referrals directly from law enforcement with the legal change to provide referral prior to arrest. So the initial conversation that we had heard was that they would be rolling this out into the January 1, 2022 contract. Currently, it is now coming out in our July 1st, 2021 contract. So they are rolling that forward. We do expect to hear by August what the parameters are for those positions across the state. So the Healthcare Authority is in development of what that looks like. And then we are tasked with turning around a plan back to the Healthcare Authority in September related to that program. So that will be a quick turnaround. In the meantime, the Healthcare Authority has worked with the Recovery Helpline of Washington to take those direct referrals in the process while each ASO is standing up those positions within their region. Fully understanding it takes a little bit of time. So there is also additional funding related to mobile crisis outreach for and it is non-Medicaid funding, general fund, state, to provide additional mobile crisis outreach with a focus on youth outreach as well. Again, another program we are waiting on details. You're going to hear that a lot through this presentation. We're waiting on details related to the expectations of each of those roles. There is language related to the 988 bill that we need to set up mobile crisis outreach teams. We are currently awaiting information to determine if we may use those positions to augment current teams or if those need to be separate and distinct teams. So we are in process of holding our breath ultimately and waiting to see what those parameters are. And I'll talk a little later as well about additional housing subsidies, and this related to Blake. There is funding specific to provide housing vouchers specifically for the SUD population related to Blake. In addition to other funding, additional substance use disorder HARPs, we had a $50,000 SUD specific HARPs allocation for last year that has doubled for our next contract cycle. So we will see a lot more specific funding related to SUD that comes in relation to Blake as well. One additional thing, and this came from CARES funding, is an additional allocation of supplemental mental health block grant and substance abuse block grant. So our current allocations around mental health block grant are approximately $320,000 a year. And we received an additional allocation of $300,000. This related to CARES. It does have to be spent by March of 23. So it'll be 18 months. We will be releasing and with the goal of July 1, a mental health block grant RFP, a request for proposal for $250,000 of treatment-related funding and recovery support-related funding. We have already sent out to our network and some community providers that this is coming. We've been waiting since March. We finally got our allocation related to the mental health block grant and are able to proceed. And there will be a mandatory bidders conference related to that July 14th. And then substance abuse block grant, the Healthcare Authority was continuing to negotiate with SAMHSA related to the substance abuse block grant. I did hear in a meeting just this morning that they came to agreement this morning. So we are hopeful that within the next couple of weeks, we will know our substance abuse block grant amount as well and be able to release a second RFP. Originally, we were going to release a single RFP for both funding sources. Now the decision has been made to release two separate ones so it does not hold up the mental health block grant because we want those funds to be expended as expediently as possible. We do expect through this RFP process that we will begin contracting in October of this year, and that would go through, like I said, March of 2023. So an 18-month funding cycle. And the American Rescue Plan Act, or ARPA, we are expecting additional block grant, and that will be a separate allocation to what we're already talking about, and can likely be used to utilized into 2025 is what we've been told. So we are hopeful that there may be enough crossover of these funds to possibly start some new programs. And the challenge with one-time funding is that we don't expect it to continue, but if we can contract in October of 21 and then be able to extend that funding into 2025, that may be long enough to figure out additional funding for some of those programs to be able to move them forward. Just a little bit more on the American Rescue Plan Act. It closes some student loan financing projects, and this isn't behavioral health specific, but I found this slide and I thought it was helpful to determine, there's insurance related, tax related issues and discharge of student loans, education investments, earned income tax credit, fisheries, EBT. We know that there were there's a lot covered under ARPA, and these impact many of the folks we serve in the behavioral health arena. All right, so Blake decision again provides funding for the SUD administrator at the ASO. They're expected to develop the Recovery Navigator program. Like I said, we will be looking at August to finalize the parameters of that position and the related positions with that role, with us identifying in September, and then hopefully the intent of the Healthcare Authority is to have that position in place by October. We do intend to most likely, based on the parameters, contract that position to existing providers within our region. So just specifically related to Blake, when we're looking at the behavioral health investments, homeless outreach programs for behavioral health, family navigators, short-term housing vouchers. There's $1 million set aside for some of those. And this is in addition to other investments in housing we'll talk about in a little bit. They have added 2 positions at the Healthcare Authority to support substance use disorder treatment expansion. There's an expansion for recovery residences, including capital outcomes assessment, so being able to determine if they are being successful. Opioid treatment expansion for co-occurring opioid and stimulant disorder, jail medication for opiate use disorder medication treatment, and some clubhouse expansion, which I don't know if Brian might speak to that, because some of that may impact recovery cafes as well. And he says, yeah.
Well, I don't have anything, I guess, to add offhand. We are part of the Recovery Cafe Network, and so we've had some conversations with them about it. We take our lead, a lot of the time from them on, yeah, those kinds of funding sources. Sometimes they may encourage us to go directly for it. Other times, because they have more clout than we do, they'll go for that funding and then help pass it through to the rest of the cafes in the state.
Great. I hadn't heard specifically what they were looking at, but definitely recovery cafes were listed as an option. So I definitely thought of Dove House immediately. One of the outcomes, and on the next slide, I'll talk a little bit more, but the Blake decision requires law enforcement agencies to refer for services for the first 2 contacts prior to pursuing legal intervention, effective July 25th. I know in many venues there have been discussions with law enforcement, and I know across the state there is a variety of reactions, and I'll talk a little bit more about that in just a second. I think one of the biggest challenges is that the resources are not yet in place. So like I mentioned before, the recovery helpline will be fielding some of those referrals while those navigators are getting up and running. So House Bill 1310, it partnered with, following the Blake decision, for law enforcement and corrections officers. There's conversations related to permissible use of force. I bring this up because it is impacting some crisis services across the state, as well as causing some challenges in developing new protocols, I think, on the law enforcement side. And I have no intention to speak for law enforcement, just wanted to share the information. So the main objective of House Bill 1310 was to act with reasonable care when carrying out duties. I will share these slides, so I'm not going to read through them, but just making sure that available and appropriate de-escalation tactics. And so with this comes the support, again, of those navigator programs, co-responder programs, funding related to law enforcement aided diversion, LEAD, LEAD programs, and the funding for LEAD programs is intended for all programs outside of King County. So they will be, we are waiting to see how they are going to share access to those. We have not yet heard. But LEAD is a diversion program that provides mental health and substance use treatment and supports and case management in place of arrest and incarceration. So Section 4 of House Bill 1310, I just added this in because I wanted to clarify what the dates were. So the Attorney General is developing and publishing model practices by July 1st. Again, it goes into play July 25th. And agencies need to adopt policies by December 1st, 2022. And then by December 31st of each year, they will be posting copies of model policies. The current experiences that we're seeing so far, like I mentioned, some challenges in law enforcement trying to determine how to track those 2 contacts or referrals prior to taking a more criminally driven focus. Again, the recovery helpline has been put in place for that. The ultimate goal, I think, is to do kind of warm handoffs to community. And again, those resources just are not in place. And the challenge of standing things up right now with workforce development issues or with workforce shortages is a serious concern related to this, with the short timeline that we're being asked to have these folks in place by October. So we are working diligently. We have heard some reports across the state, and this is very specific to areas or counties, that some areas of the state report law enforcement are continuing to support. They're seeing no changes in the engagement of law enforcement. And these reports that I'm talking about currently are significantly related to behavioral health intervention. We have heard, particularly Jefferson County, that things at this point are continuing at status quo. Some areas of the state are reporting that law enforcement are not willing to respond unless it's a criminal matter, including doing wellness checks on individuals. Some areas are also reporting that mobile crisis outreach and DCRs, some law enforcement are participating and supporting. The historical practice was law enforcement was engaged to secure the scene before EMS or a DCR was doing an evaluation to make sure that safety was paramount. But they are identifying in some areas of the state that currently law enforcement is not willing to go out or provide support in any manner, or some are in different places. So these will continue in conversations, I'm sure, across the state related to how we can best implement the new laws and make sure that individuals are safe and how that interacts with behavioral health. And I think a big piece of that are the navigator co-responder type models, as well as some of the community paramedic models that are out there. Behavioral health housing. So like I mentioned before, there are Blake-related housing vouchers for substance use disorder. We have an increase in our HARPS SUD specific funding. Hot off the presses in a meeting just this morning. Our HARPS teams may be adding additional staff to the HARPS to provide housing support to folks. And those would specifically be targeted for substance use disorder, engagement of individuals with substance use disorder who are homeless or at risk of homelessness and need additional support to maintain that. They'll also be braiding those with foundational community supports. For the first time under ARPA, I did mention the substance use block grant that was finalized in agreement with SAMHSA this morning, that there is an allowance for the use of block grant for housing subsidies. That is the first time block grant historically has not been allowed to be used for that, but for this specific special allocation of block grant, it will be allowed to use that for some housing subsidies. And we are just, again, waiting details. And then just to mention, there's a $6.2 million investment in behavioral health housing, short-term subsidies, recovery housing. Department of Commerce is working to determine how those funds roll out. Several of those possibly will be coming through my organization, the Salish Behavioral Health Administrative Services Organization, and rolling out through either our current network. But again, we're waiting on details to determine how much and where is the best place for those funds to be distributed from. We are unique in our region in that when we rolled out the Housing and Recovery through Peer Supports Program, the HARPS funding related to behavioral health housing about 4 years ago, we opted to go with coordinated entry. So OLICAP, Serenity House of Colum County, so OLICAP in Jefferson, Serenity House of Colum County, and Kitsap Community Resources in Kitsap provide administration of those funds. And we are per capita the #1 spender of our funds. We have been the most successful in making sure that those housing subsidies and housing support funds are getting out to our community. And so our team is actually presenting at a couple of conferences coming up related to those successes. So that is very exciting. We are very glad to
jump in quickly, Jolene. I know we're at 4 o'clock and there is so much good information that has been presented here. And I know everybody's going to have questions, and I'm sorry we have to cut off this meeting because of course there are a bunch of us that go into one at 4. Jolene, is there a chance we could, for those that were interested, if I could set up a time, or is there a place where you'll be presenting this information? We can encourage people to go and bring their questions. I'm happy to set up another meeting, you know, between now and our next BHC meeting, just if there are questions that people would like to ask on this.
Yeah, I would be happy to. And again, more information will be coming. So I think if we even gave it a couple of weeks, we might have more specific details about some of these things.
Okay.
Lori, I'm guessing Jolene, but I think you're going to make a similar and probably more developed presentation at the BHASO meeting coming up in June.
Yes, probably.
So that is a public meeting I'd invite people to, and I don't know, we rescheduled it so many times, I don't remember what it is.
Well, I will figure that out and get the word out to everybody. Thank you from the bottom of my heart, Jolene, for pulling all this together, because there's so much content there.
Absolutely.
Thank you, everybody else, for coming, and we're going to move into the working age group meeting shortly here, and I look forward to seeing you all next month, and I'll try to reach back to you one-on-one in between. Have a great day.
Thank
job, Jolene.
Thank you.
Congratulations on the Harps win. Good job.
Thank you.
Thank
Thanks,
you,
Jolene.